For almost 20 years, I managed a home care agency in the state of North Carolina covering 6 counties. First of all, once you decide that you are going to need services in your home, there are some things that you will need to consider. You need to find a home care aide. Are you going to go on Craigslist? Are you going to ask your next door neighbor? But how are you going to find that person? Once you do, you need to negotiate a pay rate. There are several different ways you can find out. You can call agencies, or you can ask neighbors who had home care what was the rate that they paid. But you will have to negotiate that with the worker. Also, as you're looking for a home care aide, how did you communicate with them? Were you able to just pick up the phone and call them? Did they answer you? Did they call you back? The same thing with an agency. Were they communicating with you back and forth? Because however they communicated with you in the beginning, it's likely to continue later. What is the process for you to become a client? If it's a private aide, are they going to come to your house, look at the situation, and decide what they need to do? With an agency, they will send someone to do a formal assessment. You will sign paperwork, you will know what your pay rate is, and they will give you all the details on how to move forward. As a customer, there are quite a few things that you can do as a customer to make things better and to make your home care experience go a lot smoother. First of all, your home environment is important. It's good to know if you have a pet in your home, and also if you are a smoker. In the state of North Carolina, home care aides, if they work for an agency, are not allowed to smoke in your home. But if you employ a private aide, that may be totally different. They may want to smoke in the home. However, that is your choice. But if they work for an agency, they're not allowed to do so. How are you going to handle the supplies that they need to do their job, as far as personal care for the client or supplies to do cleaning and things of that nature? Today is so important that they have masks and gloves. When they work for an agency, they will supply that. But if you hire them separately, that may be something that you need to supply for safety. Cleaning products are also something that they will need, because there is a component of light housekeeping with each service. So you would probably need to supply the cleaning products, but that would need to be cleared up front. Also, where you live is important. If you live really a long distance from a bus stop, or if you live far out, sometimes it's a little bit more difficult to find an aide. So they may have to travel. So just consider that. There are other responsibilities that you as a client can make sure that you take care of. Family members in the home, that is very important. Also, what is the relationship between the family member and the client? At one time, we had a situation where a family member came to visit a client. He was a male. We had a female aide assisting the client, and the male proceeded to be inappropriate with her, coming in the room when she was bending over to make the bed. It got so contentious that we had to remove the aide and put someone else in there that was a lot older. So that is really important, and you can really be set up for a lawsuit if that doesn't go well. There are 2 types of areas that you can seek for assistance with ADLs and personal care. There are private aides. As I mentioned, you may ask your next door neighbor, find someone at your church that you can get to come to your home and provide services. With that aide, there's also the issue of what you will pay and how will you pay them. Will you write them a check, or will it be that you will cash app, whatever it is? How will you pay them? Will you take taxes out of their check? That is very important. How about the liability if they fall at your home? Are you going to be able to cover that with your insurance? The most important thing I think with having a private care aide is if they are out, who's going to come to your home to take care of your family member? Are you going to do it? Do they have someone else who's going to come? Are you going to screen that person just to be sure if there's a backup that person qualifies? However, with an agency, a home care agency, it's a little bit different, and there are some that are covered for you if you use an agency. All agencies licensed in North Carolina do a background screening, and there are specific requirements that if the aide has something in their record they may not be able to hire them, so they will not send them to your home. They also have to validate that that aide has been trained and her skills have been validated by an RN. So if you have things in your home that need to be taken care of with the client, the RN makes sure that they can do that. Also, at all times when there is an aide working in your home, there is a manager or an RN on call for supervision. The agency itself has strict oversight by the Department of Health Services regulation for all the ground rules that they must follow. So there is a reporting procedure if it's not followed. So there is extra security if you use an agency. Are there places in your home that are off limits? Do you never want them to go in your closet if you're not the client? If your husband's the client, then you can say, never go in my closet or don't go into this room. Make those things clear up front. Are there tasks that you never want them to do? We have some clients in the past that said, I will do all of the cooking, you just heat up the food. So make that clear. Are there some tasks that you definitely want them to do? Do you want them to wash all of the clothes, make sure the person gets a bath? What are those things that are just things that you cannot do without? Make sure it's clear. Again, what is the best way to communicate with that aide or the agency? If the aide is not going to be there, can she text you? Can you text her? Will the agency call you? Will the aide call you? Those things need to be clear. Once you get care in your home, how much care will your loved one need? When they start out, they may be just using a walker, but later on, they may need a Hoyer lift. Are you sure that that aide can advance with the client and provide the level of care that they're going to need as time changes? When you have an aide working in your home, your home becomes a workplace for that person. So how are you going to handle lunch and breaks? How about the food? Or can they cook their food at your home? Can they bring it? How are you going to handle that? It just needs to be clear. Just don't assume that they will do it the way you think they will. Make sure it's clear. Household cleaning and laundry. If there are other people in the home, the aide should really just be washing the clothes of the person who's being cared for, not for the entire home. We had a situation with someone that would have her daughter bring all of her laundry for 4 kids over on laundry day for the aide to wash the clothes. Needless to say, that was an issue that we had to handle, but it does happen. Once the clothes are washed, do you want them ironed? Where do you want them to be put away? The aide needs to know how things need to be done, where the laundry needs to go, so that when she's gone home and you're looking for Mr. Jones's socks or his favorite t-shirt, you'll know where it is. Laundry supplies should also be supplied by you, and that's something you would want to cover up front. Communication is key for having a positive home care experience. You want to know up front, who is your contact person? Who do you call? Do you call the RN? Do you call the agency director? If you're using a private home aide, do you call her directly? Is there a backup that you call? How do you handle that? There should be a plan right up front as you start. If you have asked the agency or the person working for you, if we have an issue with food, how do we handle that? With laundry, there are some key elements for having a positive home care experience. Communicate often with the home care staff and management or the aide that's working for you. Make sure you're talking back and forth. Be clear about what you need. If there are things that are not being done properly, try to go ahead and address that right up front. Take care of those problems as they arise. Don't allow them to fester and become larger, because many times it's just a misunderstanding and things can be cleared up. However, if you go in with the correct understanding, that experience can be more positive for you.